Hi, it's Reginald again. Welcome to our channel Licensure Hub. I hope you've been enjoying the previous videos that we've uploaded so far. Today, on our content, we are going to look at how to serve an infusion to a patient, that is setting up an IV infusion. This is a very key technical aspect of medication administration that every nurse should be able to do. And thus, if you are given this task in your final exams, you should know how to go about it. And so I urge you to sit back, relax, and enjoy the video. If today happens to be the first time you are joining us, don't forget to click on the bell icon there and subscribe to our channel and follow us as things will get more interesting. Thank you. Before the nurse sets up an IV infusion on a patient, remember this is a trolley procedure. And so since it's a sterile procedure, the nurse must bath the trolley first with soap and water, rinse the trolley nicely, and then disinfect with either a Savlon or a spirit, which can be used to disinfect. So after bathing the trolley with your soap, sponge, and water, you disinfect the trolley. As you can see, we are using spirit. If you are going in a circular manner, you go in that circular manner. Or if you are going in a linear manner, you go in that linear manner, observing the correct sequence that you can follow. And so this is how you disinfect the trolley with a sterile gauze, and then you can use it only in one direction. You should avoid jerky and jarry movement. One direction only. Disinfect all the sides of the trolley, the metallic parts, as you can see on your screen. You do both the top shelf. When you are done with that, you move to the down shelf. Disinfecting the trolley helps to prevent or minimize the introduction of microorganisms which you cannot see with our naked eyes, which can cause systemic infections to the patient. That is the main reason why we should bath our trolley and disinfect our trolley, because we'll be injecting this medication or we'll be setting up a line which requires sterility. Thus, the most important thing to do is to make sure your trolley is sterile and well cleaned before setting up, as you can see on the screen. After disinfection of the trolley, the nurse then picks the sterile drum, which is back from CSSD, in its pack. Open it nicely, ensuring that your bare hands do not touch the inner part of the pack. With the help of a Chittle forceps, you open up the sterile drum or pack in order to pick up the items from the drum or the pack. So that's the Chittle forceps that has been used to open the lid of the tray to maintain sterility. The green towel is being covered with a green sheet, is picked up and dropped directly on the top shelf. Remember, you don't touch the inner part of the green sheet as you can break the sterility. After dropping it, you pick up the Chittle forceps to help you open up the green towel in order to spread it across the top shelf of the trolley. So with the help of the Chittle forceps, the nurse opens the green towel and covers the top layer of the trolley, creating an opening that can be used to cover the top shelf when you are done setting the top shelf. You pick up your gallipot, you open it in a sterile manner, ensuring you don't touch the metallic gallipot. You drop it gently on the top shelf. You need 2 gallipots, so we pick the second one, open it in the same manner as we did the first one, and drop it gently on the top shelf. Remember, this procedure is setting up intravenous infusion, which is a trolley procedure which will require sterile technique in setting up your trolley. The top shelf contains your 2 gallipots, one which contains sterile cotton wool swab. You open it into one of the gallipots, as you can see on your screen, and the other gallipot contains the spirit. The spirit. These are the only 2 requirements on the top shelf of the trolley. So you open the spirit or disinfectant and pour it at least 2 to 5 centimeters away from the kidney dish. Away from the gallipot. You pour it 2 to 5 centimeters away from the sterile gallipot so that it doesn't contaminate the lid or it doesn't contaminate the gallipot. The 2 gallipots are then covered with a lid. So one gallipot contains sterile cotton wool swabs, whilst the other contains spirits. So by the help of the Chittle forceps, we cover the 2 gallipots, as you can see, and we cover the top shelf with a folded portion of the green towel. We then cover the top shelf with a folded portion of the green towel, and that ends our top shelf. So that ends our top shelf. We move on and reassembling the sterile items well in the pack, covering the tray and assembling or dressing the pack nicely as it was before, so that if we need any sterile items again, we can go back for it. So we cover it nicely to continue to maintain the sterility of the inner equipment that we may use in a nearby future to perform any tasks. So this is how we lay the top shelf, ensuring a sterile technique being used. After preparing your top shelf, we have other items that are assembled at the down shelf. These items are well arranged in a tray. Items include the sterile gloves, dressing towel, a small drawer marking touch, your infusion, your sterile cotton, your tourniquet, your spirit or disinfectant, your cannula of the right sizes that you want to use, your giving set, all are at the down shelf. We also have the vital signs tray, also placed at the bottom of the shelf. You have your disposable gloves as well. Then your drum with your Chittle forceps is also assembled at the down shelf. So this is how we prepare the trolley for setting up an intravenous infusion. Remember, we have the top shelf and the down shelf as displayed on the screen. In beginning the procedure, the nurse explains the procedure and the purpose of the procedure to the patient and reassures him or her. So you explain what you're about to do to the patient, spelling out into details why you need to do this in order to gain the patient's cooperation throughout the procedure. And so it is very important for a nurse to establish rapport and explain procedure to patients in details, telling the patient what you are coming to do, the things you are going to use to do the procedure, and how the patient can also help or cooperate once you do the procedure. It's very important for the nurse to spell out all these things as it ensures efficiency and cooperation. So as you can see on the screen, the procedure is being explained to the patient in order to gain the cooperation of the patient before the procedure begins. Mr. Macbeth, good evening. How are you doing? Okay. I'm Nurse Reginald, and this morning when the doctors came around, they realized that you were very dehydrated, and so they prescribed that we should give you an infusion called the normal saline. This infusion is meant to hydrate you and then restore your hydration level. So with this procedure, you will require to use the washroom. And if you want to use the washroom, I could assist you with a bedpan. If you want to use the washroom, you have to also uh, try and use it so that when the process is going on, you wouldn't have to stop it and then you have to go back and be coming back and forth. So I would like to use the washroom, or I can help you with that. Okay. Are you okay with everything? Do you need me to explain anything further into details for you? Okay, thank you very much. I'll be back in a jiffy. After the patient has given consent, the nurse proceeds to check the physician's order for the type of infusion and also checks the rights of the medication administration, which includes the right patient, the right drug, the right dosage, the right time, the right to consent and refuse, and the right route. These are confirmed at the bedside of the patient whilst establishing the rapport with the patient. I'm back again, and as I discussed with you earlier, I'm to give you IV infusion, and that IV infusion is IV normal saline 500 milligram. You are going to take it through your IV line. That's what I'm going to give you. You have to take IV normal saline 500 mils, and this medication is going to go to your IV line. You have to take it at 6 p.m. in the evening, and you have the right to infuse this medication or the right to also not take the medication. However, I encourage you to take this medication because it will help restore your hydration status so that you can be able to get very well and go back home. So I encourage you to take it very well. It's important to also check for the cloudiness of the infusion for any particles or any unwanted particles in the infusion that will render it unsafe for use. After checking all this, the nurse then encourages the patient to use the bedpan because in the process of the infusion therapy, Mr. Mensah, would you like to use the washroom or would you like me to serve you a bedpan? Okay, you are comfortable. Okay. So I'm going to check your vital signs. I'm going to set a thermometer into your armpit so that you begin the process. Thank you very much. The patient may want to use the washroom, which may interrupt the procedure. And so it's very important to encourage the patient to use the bedpan or the washroom if the patient requires to do so. After doing or encouraging the patient to use the bedpan or the washroom, the nurse proceeds to check the vital signs for the patient. Checking the vital signs, temperature, the pulse, the respiration, and the blood pressure are all checked to ascertain the baseline data. It is checked to establish a baseline data so that the nurse can determine any transfusion reactions that may occur in the process of transfusing the infusion. The principal reason for checking vital signs before administering of infusion is to establish a baseline data in order to determine any transfusion reactions that is likely to occur when the infusion is on the patient. As you can see on the screen, the nurse is checking the vital signs, which is one of the key or basic techniques that is required of any nurse to do. Once again, viewers, this procedure is about setting up an intravenous infusion on a patient. If today happens to be the first time you are following us on this channel, I urge all of you to subscribe to this channel so that as and when we release any video, you will be notified accordingly. After checking the vital signs, the nurse records the vital signs on the observation chart, that is the temperature, the pulse, and respiration, as well as the blood pressure, to serve as a baseline data so that when you are given an infusion and any transition reaction occurs, the nurse can tell from the vital signs that there are being changes, and so there's a transition reaction going on. After checking the vital signs, the nurse then, after recording the vital signs value, the nurse then positions the patient properly for the procedure to continue. So I'll inspect how we are going to insect in it. The nurse proceeds to position the patient well in bed, ensuring that the arms are out. The site where it's going to put the cannula is inspected for any rashes or any wound. The nurse positions the drip stand by the bedside properly, removes the plaster and prepare the plaster by securing the ones that he's going to use to secure the cannula at the side of the trolley. As you can see, you tear the plaster of appropriate sizes that the nurse wants to use to secure the cannula when passed. So it can be taped on the metallic side of the trolley so that as soon as you are in the vein, you don't waste time with your plaster again. After preparing your plaster, the nurse picks the infusion or the giving set, opens the giving set gently, as you can see on the screen, picks up the infusion. He opens the giving set, picks up the infusion, removes the cap from the giving set, and inserts the piercing needle into the rubber seal of the infusion bag. When you do this, before hanging the infusion, ensure the cork is closed. The cork of the giving set is closed. If the cork is not closed, it may cause the infusion to run through and pour on the floor. So you secure it in position and attach the other side of the needle to the giving set to ensure there is no air that enters, and hangs the giving set together with the infusion bottle or bag on the drip stand nicely, as you can see. The nurse then positions or stretches the arm of the patient after inspecting everything, inspecting the site. If the patient is hairy, shave per hospital policy or protocol. You protect the bed with your draw Macintosh, a small draw Macintosh, and your dressing towel, which can be a green towel. Remember, it's a sterile procedure, so all rules of sterility apply. So you protect the bed with your dressing Macintosh and your green towel of small sizes, as you can see being displayed on the screen. After that, you fill the chamber of the infusion bag halfway. You fill the chamber halfway and expel air from the given set. Expel air from the given set. It is important for the nurse to expel air from the given set because if this air is not expelled and the infusion is run through the vein of the patient, it can travel and form something we call an emboli or embolus, which can cause other health problems for the patient, such as ischemic stroke or pulmonary embolism. Therefore, it is important for the nurse to expel air from the given set as the infusion is being hung. After expelling the air, and position the patient well with the help of the Chittle forceps, the nurse opens the sterile field or the top shelf of the trolley and puts the Chittle forceps back into the drum, ensuring the maintenance of sterility. The nurse then opens the sterile glove in a sterile manner and drops the inner side of it on the top shelf. Remember, the sterile gloves comes in sizes, and so as a nurse, you must know the appropriate size you wear so that you prevent or avoid difficulty when wearing the sterile gloves. It ranges from 7, 7.5, we have 8.0. The wearing of a sterile glove is a skill that every nurse must have. And so we all, as nurses, must learn how to put on sterile glove without a break in the sterility of wearing a sterile glove, so that we can maintain the sterility of the procedure. After wearing the sterile gloves, you take the sterile cotton soaked with an antimicrobial solution, that is a methylated spirit, to clean the site that the line is going to be set. And you ask an assistant to apply a tourniquet. Remember, you are now in a sterile glove, so your hands are above the waist. So with the help of an assistant, the assistant apply the tourniquet so that the nurse can locate the vein. The assistant then also helps to open up the right size cannula. Remember, once you are in a sterile glove, your hands do not go below your waist. And so the assistant helps with the application of the tourniquet and also helps to open the part of the cannula so that the nurse can pick the sterile needle inside the pack of the cannula. The assistant can decide to drop it on the top shelf, or the nurse performing the procedure picks it up directly from the sterile pack, ensuring sterility is maintained. The nurse picks the cannula, palpates the vein, and once the nurse locates the vein, it gently withdraws the needle. You remove the needle straight into your sharp box, as you can see being displayed on the screen. And once you are in a vein, you see a gush of blood flowing into the cannula. Then with a little pressure, pin on top, and with the help of the white cork, the nurse secures the cannula at the opposite end, or connect the infusion bag directly and regulate the flow as ordered. With the help of a plaster, the nurse secures the cannula in position. Viewers, this is Licensure Hub channel, and displaying now is a procedure called how to set up intravenous infusion. Again, as soon as the nurse locates the vein, the nurse must take the tourniquet off and continue the procedure. If today happens to be the first time you are joining us, I'll urge all of you, or the first timers, subscribe to our channel so that as and when we release any new video, you will be notified and follow us accordingly. So again, the nurse observes for infiltration or hematoma. In regulating the flow as ordered, the nurse reads the doctor's orders and regulate the flow or calculate the flow rate as ordered. In calculating of the flow rate, the nurse must ensure that he gets the calculation correct so that he can regulate the flow as ordered. The nurse then observes the infusion accuracy. Any sign of swelling around the patient's side is a sign of infiltration. That is, the infusion is entering into the tissues and not into the vein. Observes the cannula that there is no infiltration into the tissues, that the infusion is going smoothly with no kinking of the given set or the tube. Also spelling out the patient about the signs of transient reactions which include headache or difficulty in breathing, the patient should quickly notify the nurse if he or she feels any of these symptoms. The nurse monitors the infusion accuracy for 5 minutes and continue to observe the patient's site for any sign of swelling. The nurse then records the time of setting up the infusion, the type of the infusion, the amount of fluid on a chart that you can see on the screen called the fluid intake and output chart. Ensures the patient is comfortable in bed. The nurse then thanks the patient and make him or her comfortable. After thanking the patient, you will now discard your trolley, you wash and dry your hands.